Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the August 24th media availability. Thank you for being with us.
Thank you.
Would you like to start by addressing the community?
Oh, I did want to mention, obviously we're all aware of the fires that are happening across the state of California and how difficult this has been for families in these areas. Although we have no evacuation shelters set up here, my understanding is that there are individuals coming to the area, essentially, to camp or basically to seek refuge with family or friends. Obviously, we've been messaging from the start of this about the risks inherent in people gathering with family and friends, especially in their household. We understand the situation here is challenging and a little different than what we've been talking about in terms of socializing. And so what I can tell people is that if you are having relatives or friends who are needing to come and stay with you because they're evacuating, there is no completely safe way to do that. However, there's some things you can do that may be useful. If you have any capacity in your home setting to have individuals who are not actually inside your home or are able to be in a portion of your home that has its own bathroom and facilities for the 2-week period of incubation, that would be ideal. We understand that's probably not possible for most people. If you can mask in common spaces, that's useful, using lots of hand washing, frequently cleaning commonly touched surfaces, especially bathrooms, doorknobs, handles, refrigerator, all of those things. Doing meals outside rather than sitting around a family table so that you can distance more effectively is helpful. And I think the really critical thing is that if you have been socializing outside your household members to any extent, that right now, if you're bringing in new people, it's particularly important to not do that, to really limit your contacts to the people inside your household, particularly through this first couple weeks when people arrive here. And the reason I say all of that is because we know that most areas of the state are having more transmission than we do, so the people coming here are just simply or maybe at increased risk of having been exposed where they live to COVID. So it's just an extra safety measure for everyone.
Thank you. Was there anything else that you wanted to touch on?
So I did want to just quickly address a rumor that was inquired about by media. And there's a rumor apparently going around that a skilled nursing facility has an outbreak going on with many cases, hospitalizations, and deaths. I want to assure people that that is not the case. We have had a healthcare worker infection in a couple of the skilled nursing facilities. Additional testing to date is not identifying any residents, at least at this time, that have COVID, and we'll be doing ongoing testing in both facilities.
Thank you. The Lost Coast Outpost asks, how frequently should we be washing our face coverings? After every wearing? What if you've only worn it for a few minutes, say while grocery shopping?
So there is really nice information about this both on the CDC website and the CDPH, California Department of Public Health website as well. But you can certainly, the ideal is to use a mask, and once you take it off, wash it before you reuse it. I think we're all aware that if you're out and about, sometimes that isn't quite possible. The rule of thumb then is that if you remove your mask, that when you replace it on your face, that you use hand sanitizer or wash your hands after handling the mask, and that at minimum you wash your mask daily if you're using a cloth mask.
Thank you. The Lost Coast Outpost asks, a reader writes, there are conflicting policies at local grocery stores regarding reusable bags and reusable containers for bulk items like oils and grains at the co-op and ENF. Would you please clarify the current, as of today, state guidelines and county guidelines if they differ for this? I'm ready to mask up and refill my oil bottles, but I'm getting told no, and no one can give me the reason or a timetable for that to return. A published rule or note about this might help everyone, customers and businesses, to be on the same page.
And I get it. I mean, sometimes it is a little bit confusing. I would suggest a couple things. One is certainly the grocery stores, co-ops, those types of entities, There is guidance for these types of facilities available, and so they certainly should be apprised of recommendations right now. I would say that is an issue with sort of the shared containers of goods. And the reason, of course, is that if you have, for instance, scoops that are being used on bins, the fact is that you have multiple people handling those things. And if you are refilling bottles, things like that, again, it's just a frequently touched surface and a possibility for cross-contamination with what you're bringing in and that. So I think in that instance, these bulk items have been something that have been excluded from use right now, although we'd all love to see them come back. That is the rationale for it. But again, the entities themselves do have industry-specific guidance that can help them craft that safe environment in their store.
Thank you. The Times Standard asked, Dr. Frankovich said there were around 60 or so confirmed cases per 100,000 in a recent media video, but the county's dashboard states estimated rate of confirmed cases per 100,000 is 236 for Humboldt County. Can you explain this discrepancy? Is the information mislabeled?
No, actually the information is correct. Both it is true that our case count, that is our 14-day case count of about 60 per 100,000 is accurate. And what the difference is that when you look at the dashboard, the estimated case rate of confirmed cases per 100,000 being 236, that is total in the pandemic. I mean, it's used to gauge against both the state and national numbers of what have we had in terms of COVID compared to 100,000 population. So that is a cumulative total over time. The other is a metric used to measure where we are with COVID right now, and that measures over the last couple of weeks.
Thank you. Mm-hmm. The Times Standard asked, what is the recovery rate in the 0 to 19 age group?
I think, again, we hesitated on sort of how we categorize and putting up recovered on the dashboard. And the reason is that, again, as I've pointed out in the past, there is no standard definition for this across the state or across the country. What we have done is we've defined basically active cases as cases that are confirmed COVID cases who are still in isolation. Typically that means who are, you come out of isolation when you are 10 days out from onset at least, and you have had fever you have had no fever for at least 24 hours without the use of fever medicine, and your symptoms are improving. So people come out of isolation are no longer called active cases when they meet those criteria. They may still have a cough. They may still have a loss of taste and smell. They are no longer considered infectious and in isolation at that time. So recovery rate is kind of a funny term, and we just want to let people know that basically what we're really talking about is people coming out of isolation. At this time, we are not following people until complete resolution of all symptoms. And so we really don't have data on how long does it take the average person to get over their cough. We look to national data for that.
Thank you. The North Coast News asks, what should schools do during an outbreak of the coronavirus disease?
Well, and certainly we have no outbreaks at this time. And in terms of what we will do during outbreaks of COVID, first of all, we're going to try and prevent them. And the way we do that is with all of the controls that the schools are putting in place. In addition to the physical environment, also looking at their practices on site and screening for symptoms in students and teaching staff and other staff in the school. If we have a single individual who has COVID, that may mean, depending on the setting, that it might mean a classroom is quarantined, but the remainder of the school continues. At some point, if we're having multiple classrooms involved, or if we're having multiple different lines of transmission within a school setting, there may be a need to actually close the school temporarily. There are guidelines provided by the state for how this might look, but anything like that would be done in a discussion between public health and the school.
Thank you. The North Coast News asks, President Trump announced Sunday the emergency authorization of convalescent plasma for COVID-19 patients. What are your thoughts on the treatment?
So at this time, there's really only very limited data, small studies, and nothing that at this point I would say we can hang our hat on in terms of its utility. It also is something that is not in unlimited supply. You can't simply crank up another factory to make more of this because it's basically made from a human blood product. And so I think it is really important that we follow the scientific protocol, that we actually do this as an investigation, that we select patients to get it, that we select patients who don't get it until we prove that it is an effective treatment. It's the best way for us to understand whether it works and who it works best for. Because even if it shows some efficacy, if you're using it on very mild patients who would have recovered anyway, and you're not comparing that to more severe patients, it may not be possible to really understand how it should be used for the long term in COVID.
Thank you. The Redwood News asks, previously you've discussed testing at HSU of students that have been returning to campus. We also know that students arriving are supposed to quarantine for 14 days. Are you concerned at all that students are not doing this? That the quarantine policy is not being enforced properly? Or on the flip side, do you believe that students are doing a good job of adhering to the quarantine policy?
Well, I think that the university, and I certainly know both for Humboldt State University and College of the Redwoods, that they've done messaging about sort of what's expected, what the risks are, and what expected behavior is in terms of facial coverings, distancing, and gatherings. I hope that the students are doing a good job at that, just as I hope that the majority of our county residents, if not all, are doing that as well. And I think everyone struggles with some of these features, with particularly around enforced social distancing and not gathering. And all I can say is that I'm hoping that the newest residents of our community are following our recommendations and local orders.
Thank you. The Redwood News asks, we've seen an increase in cases among younger people more recently. Are you able to talk about the range of symptoms that younger people in the county have been experiencing? Have they had milder symptoms? Were they asymptomatic? Were any severe cases, or did any require hospitalization?
So overall, in terms of symptoms, we certainly know nationally across the state and locally that younger people tend to have either asymptomatic disease or milder disease. I think that's been well characterized. We actually haven't compiled our local data to really prove that to be the case, but I think it's pretty widely understood at this point. That is not to say that younger people don't get serious illness at all. It just happens at a lower frequency than it does for older individuals or for individuals with underlying health issues. That being said, I can tell you that our mean age for hospitalizations in our county right now has been about 65 years of age, and that we've had a total of 4 individuals under the age of 40 who've been hospitalized to date, if that gives people a little bit of an idea.
Thank you.
You're welcome.
Caveman News asks, can you explain why the DHHS is able to identify recent positive patients as HSU students and unable to identify positive patients in particular towns versus regions?
Well, I would note that public health is not really reporting on individual cases at HSU. HSU is reporting on their cases just as CR reported on theirs. So it's a function of the universities. That was not a public health function.
Thank you.
You're welcome.
Kaba News asks, according to the county's COVID graphic on race, it states that 0 of our Black community members have contracted the virus. Is that true?
Well, what I would tell you is that when we look at this data, about half of the individuals who have been confirmed cases, we do not have self-reported data for race or ethnicity. And so it is true that in terms of our self-reported data, we've had nobody who is identified as Black among our positive cases. But again, with half of our cases not specifying, I have no way of knowing if there may be some of our residents who are Black who have had a positive case.
Thank you, and thank you for being with us this afternoon.
Thank you.